Hello guys, welcome to my YouTube channel. My name is Dr. Achievement. So I was just going through some documents and I was just reading some things. I just pop into bone disorder, and I was like, why not share this? It could be helpful for someone in the YouTube uh, channel. Okay, uh, I just want to briefly explain what bones are. The skeletal system. The skeletal system is the part of the skeletal system consists of bones, joints, cartilage, ligaments, bone to bone, tendon, and bone to muscles. So is divided into two divisions: axial skeleton and appendicular skeleton. The axial skeleton consists of the skull and the spinal column, whereas the appendicular skeleton consists of the limbs and the girdle. So functions of bones: support of the body, protection of soft organs, movement due to attached skeletal muscles, storage of minerals and fats, blood cell formation. It helps us to form blood cells. It help our body posture. It helps support protection of soft organs, movement due to attached skeletal muscles, and etc. So bones of the human body, the skeleton has 206 bones. Two basic type of bone tissue: compact and spongy. All right. Two basic type. We have the compact bone and we have the spongy bone. All right. So bones are classified by their shape. All right. Long bone, short bone, flat bone, or irregular bone. All right. Long bones are examples: the wide arms, legs; short bones example: the ankles, wrists; flat bones, skull or sternum; irregular bones, vertebra or pelvis. Classification of bones on the basis of shape: long bones, you can see the humerus arm; short bones, you can see the carpa, the of the wrist; flat bone, you can see the bone of the skull, parietal; irregular bone, you can see the vertebra. All right. Bone fractures: a break in a bone. Types of bone fracture: we have closed and open. Closed simple fracture, break that does not penetrate the skin. Yeah. Penetrate the skin. Open compound fracture, broken bone penetrates through the skin. Green stick: phrase hard to repair, break like a green stick. Green stick example of green stick. Let me say a fracture whereby it's a bit bent in such a way. It's not a Most times it's not a complete fracture, and it's mostly found in kids. All right. Bone fractures are treated by reduction and immobilization. Okay, this is the skeleton, the human body. We can see the head and the vertebral columns, and we can see the other parts of the body. All right. We differentiate these: the axial skeleton and the appendicular skeleton. Types of joints: we have hinge joints. A hinge joint allows extension and retraction of an appendage, especially elbow and knee. We have the ball and socket joint. The ball and socket joint allows for radial movement in almost any direction. They are found in the hips and shoulder, hip joints and shoulder joints. We have the gliding. In a gliding or plane joints, bones slide past each other. Mid carpal and mid tarsal uh, joints are gliding joints. All right. Saddle joint. We have the saddle joint. This type of joint occur when the touching surface of two bones have both concave and convex region, with the shape of the two bones complementing one another and allowing a wide range of movement. Thumb, example of saddle joint, thumb. All right. So now coming to the bones pathology that made me want to talk about this topic. Disease and conditions of the skeletal system. Arthritis, it's a common non-term. We have different kind of arthritis. Rheumatoid arthritis usually affects joints. It's a kind of growth in the joint region, and it will cause pains if the growth is persistent, and it will cause discomfort. All right, sorry. It's mostly arthritis is mostly occurs in joints. Rheumatoid arthritis is a different kind. I won't be explaining further. I'll just tell you the pathologies that could occur in bones. We have arthritis. All right, it can affect basically all the joints. All right, mostly the shoulders, wrists, hands, elbow, ankle, etc. We have this is rheumatoid arthritis late stage. It can cause a deformation. Okay, you can see how the hand is deformed. All right, see the X-ray. Arthritis is basically a kind of growth in the joint, and it causes pain whenever the joint is trying to move. Joints move in a little space of either gliding, sliding, or rotation or something. But if there's a growth of bone, abnormal growth in the joints, like you can see in this X-ray, it will create some disturbance. Like you can see here, you can see this is completely fused. You can't identify. This is sorry for that. You can't identify nicely. This is a bit better, but it's still having some issues in this area if you could observe. Respect this, guys. You can see the picture I put in this slide, the way the arm is. Tendonitis. Tendonitis. Sometimes the tendons become inflamed for a variety of reasons, and the action of pulling the muscle become irritating. If the normal smooth gliding motion of your tendon is impaired, the tendon will become inflamed and this movement will become painful. What is the tendon? The tendon, I'll show you a picture. This is called tendonitis, and that means inflammation of the tendon. The most common cause of tendonitis is overuse. What is a tendon? I'll show you a picture. This is the muscle here. Okay, this is the muscle. All right, the muscle is this one. Now, the tendon is the part of the muscles. The muscle did not insert to the bone directly. All right, the part of the muscle that inserts to the bone. All right, so if this part of the muscle is having some issues, it could be caused due to infections or whatever, stress and the rest, then it will be inflamed, and this condition is known as tendinitis. It could happen in shoulder joints, it could happen in any joint. All right, any area where the muscle is attaching to, if you identify the tendon of the muscle. But this picture is just showing the Achilles tendon. Carpal tunnel syndrome, any condition that causes swelling or change in position of the tissue within the carpal tunnel can squeeze and irritate the median nerve. Irritation of median nerve is in this manner causes tingling and numbness of the thumb. index and middle fingers, a condition known as carpal tunnel. You can see here, okay, this is a surgery that has been done. Okay, this is a surgery at this area. 1 minute, let me see. Here, good. At this area, there is something called carpal tunnel. Pardon me. This is a good example of that. It's it's like a muscle fibers running this way, but if this fiber is having infection or is being compressed, because there's a lot of structures running from here to the hand. All right, so if these structures running from here or there's inflammation, and especially due to the median nerve runs through this place, it could cause tingling sensation. It could cause issues. You feel some numbness in the arm. All right. Osteoporosis. Osteoporosis. All right. Osteoporosis is a term that means porosis bones. Porosis bones. It is a skeletal disease affecting women and men. Osteoporosis is a condition in which bones have lost minerals, especially calcium, making them weaker, more brittle, and susceptible to fractures. Any bone in the body can be affected by osteoporosis, but the most common places where fractures occur are the back, spine, hips, and wrists. All right. Sometimes most of us, we lose calcium. We don't take much calcium food, and we're having a poor calcium in our body, and our bones will not be able to heal because the mineralization is gone, and it will look something like this, and it will be susceptible to fracture. This is the kind of a normal bone, but this is an abnormal bone, like inside. All right. Scoliosis. Scoliosis is abnormal curvature of the spine. If your child has scoliosis, the view from behind may reveal one or more abnormal curves. Scoliosis runs in family, but doctors often don't know the cause. More girls than boys have severe scoliosis. Adult scoliosis may be a worsen of a condition that began in childhood but wasn't diagnosed or treated in other cases. Scoliosis may result from a degenerative joint condition in spine. This is kind of scoliosis where the spine is going in a I would say C kind of half shape. All right, the spine is not in a like the normal spine is straight, in a very straight, like you can watch this white line, a very straight line. All right, but the abnormal curve of spine is going in scoliosis way. All right, so in this, if this happens in your spine, then definitely this other side is getting more weaker and this other side is getting more bumpy. You can identify the difference between this side of the body, the left side of the patient, and the right side of the patient. All right. Ricket is softening and weakening of bones in children, usually because of extreme and prolonged vitamin D deficiency. Some skeletal deformities caused by rickets may need corrective surgery. We talk about calcium deficiency or mineral deficiency causing osteoporosis. In this, we're talking about vitamin D deficiency causing rickets. Rickets. All right. Okay, you can see this kind of legs. Many children used to have some issues like this. This is due to poor vitamin D, and the bone is not getting a good formation. All right, you can see this condition. We call this bow leg. All right, you can see this condition, valgus and varus. And if you want to use the physiotherapy terminology, you can see this condition. All right, scurvy. The human body lacks the ability to synthesize and make vitamin C and therefore depends on exogenous dietary source to meet vitamin C needs. Consumption of fruits and vegetables or diets fortified with vitamin C are essential to avoid scorbic acid deficiency. Even though scurvy is uncommon, it still occurs and can affect adults and children who have chronic dietary vitamin C deficiency. Oh, this is an example of scurvy. I think this is tooth like, and we talked about deficiency of vitamin. We have talked about three deficiency now. That means these nutrients in the body are so important. We have talked about the deficiency of vitamin D, deficiency of calcium, deficiency of vitamin C right now. So scurvy can is a kind of disease that is caused due to the deficiency of vitamin C. Now we are in gout. Gout is a disease that results from an overload of uric acid in the body. This overload of uric acid leads to formation of tiny crystal of urates that deposit in tissues of the body, especially joints. The crystal form in the joints. It causes recurring attack of joint inflammation. Chronic gout can also lead to deposits of hard lump of uric acid in and around the joint and may cause for joint distortion, decreased kidney function, and kidney stones. All right, so this is a gout, a kind of this is an example of gout. We talk about decrease of some minerals. It can lead to some bones disorder. Now, increase of something in the body is also causing. That means you just have to make everything in a normal balance. You don't have to increase anything. You don't have to decrease anything, any of the essential nutrients in the body. All right. So bone erosion, you can see it's causing. There's a bone erosion there. Like, okay, let's proceed. You can see example of gout. This is example of gout. Increase of uric acid deposited in the body. Acromegaly. Acromegaly is a serious condition that occurs when the body produces too much of the hormones that control growth. The hormone most often affects in the hormone most often affected is called growth hormone or GH. It is produced by the pituitary gland, a tiny organ at the base of the brain. Growth hormone promotes growth of the bone, cartilage, muscles, organs, and other tissues. When there is too much growth hormone in the body, these tissues grow larger than normal. This excessive growth can cause serious disease and even premature death. Gant disease, example of this. This is human hand, alright, in X-ray. You can see how long it is, how big it is, growth. We used to see people who are so tall, and though those people might not be having some disorder of acromegaly, but some people, most people who are so tall have this disorder, and especially in the soft tissue organs. Or you can see how big his face is in this picture. You can see how big his feet is. You can see how big this skull is. The soft tissue is getting much, growing more than normal. That means there is more increase in growth hormone. You can see spinal bifida. Spinal bifida is a birth defect that involves the incomplete development of the spinal cord or its covering. The term spinal bifida comes from Latin and literally means split or open spine. Spinal bifida occurs at the end of the first month of pregnancy when the two sides of the embryo's spine fail to join together, leaving an open area. In some cases, the spinal cord or other membranes may push through these openings in the back. The condition usually is detected before a baby is born and treated right away. Alright, this is spinal bifida, example of spinal bifida, where according to what I just read, it said it will leave some opening and something will push through. You can see this spine is showing that things are coming up, almost going out. This is the nerves, right? It's almost moving out. You can appreciate from here as well. You can appreciate this. This is in a severe condition. Talipes equinovarus, clubfoot. Clubfoot is a deformity of the whole foot that is present at birth. There are several types of clubfoot that are jointly known as talipes. As the deformity is mostly in the talus, a bone in the ankle, the most common of the talipes is what is known as Talipes equino virus. It is so common that the word clubfoot is commonly used to refer to this. In Talipes equino virus, the child is born with the foot pointing down and twisted inward at the ankle. Alright, you can see. You can see this a severe case of a baby. You can appreciate this picture and this one. Okay, guys, thank you for joining the class. Uh, please hit the like button, subscribe, share the video. Thank you and have a very nice day. I have more content in my playlists. Click if you want to see more content on physiotherapy, and I'll be uploading more. All right. Have a very nice day, guys. Thank you.